Hi, I'm Ryan Rennick. Today we're just going to be going over a quick overview of optogenetics, so let's get right into it. So, our learning objectives for today are going to be to describe the process of optogenetics and the proteins involved. And we're just going to describe some past research in optogenetics and implications of future studies. So, that's our goal for what we should be able to do after this. So, a quick review. Optogenetics is going to be using primarily two light-sensitive proteins, which can be placed in neurons when attached to a harmless virus that spreads throughout the central nervous system. And one of those proteins is going to be channel rhodopsin, CHR2, which is found in green algae. It's going to open the sodium channel when exposed to blue light, and it's going to have an excitatory effect on the neuron. And then, can't pronounce that one too well, but NPHR is found in bacteria, opens a chloride channel, and that one is going to have an inhibitory effect when it is exposed to green or yellow light. So with those, I'm going to be taking a look with classical conditioning. So classical conditioning, aversive stimulus, and then our neutral stimulus, like a tone, just a sound, is going to be eventually paired. So we're going to be conditioning mice in the two studies we look at to basically show a fear response conditioned by this puff of air, and then we're going to be looking at fear extinction, which is the decrease in that fear response with continued absence of the aversive stimulus, the fear stimulus, which is the puff of air to the eye that was originally paired with that neutral stimulus, the tone. So as that aversive stimulus decreases, we're going to be looking at the extinction of that conditioned response in mice. Then we're going to be looking at some implications with optogenetic stimulation of the infralimbic subarea, which is within the medial prefrontal cortex. We'll be looking at its role in the retrieval extinction. Retrieval extinction is a term describing this reactivation of this fear memory after its conditioned response has decreased towards extinction. So when you're looking at good retrieval extinction, it can be marked by a moderate response. We'll take a look at that in the graph in the next slide. And a good retrieval extinction with this moderate response to this reintroduced stimulus is going to prove to be a strong candidate for later exposure/extinction therapy. Whereas poor retrieval extinction is going to be marked by a stronger response, and that's going to say that that particular patient is not going to respond well to exposure therapy. So let's take a look at this graph. Here we see in green that good extinction retrieval. See how it's a lower level of response. So if that's good in fear condition, we want to see that lower level of response, especially with exposure therapy. The poor extinction retrieval, however, is very high up there in conditioned response. That's almost at the same height as the peak of the conditioned response. So we don't want that. That's going to indicate that they would not be a good candidate for exposure therapy. So, taking a look at some studies, we're going to be looking at the medial prefrontal cortex, like we talked about, and its subcortical output to the amygdala, plays the fear response and emotional processing. So we know a dysfunctional medial prefrontal cortex is correlated to those anxiety disorders and cognitive deficits. So we're going to be looking at the infralimbic subarea within that medial prefrontal cortex, seeing if we can stimulate that to possibly avoid some of these side effects. So one study used CHR2, which is the excitatory optogenetic technique. They used that on the infralimbic subarea, and that resulted in isolated excitation, as they expected, and it also increased sensitivity to excitatory inputs from somatosensory signals, so signals from the body. And then they found that stimulation of this infralimbic subarea facilitated extinction, so decreased the fear response, which is what we want, to decrease those symptoms of anxiety. So future implications of this are going to probably take a look at neuropsychiatric disorders, like we're talking about anxiety, schizophrenia, and depression. Another study used NPHR, which is the opposite effect of CHR2, so it's going to be silencing, inactivating those neurons. when exposed to yellow light. So we found that during retrieval of the fear extinction, so the reintroduction of that fear response, it did not impair that retrieval. So we saw normal response there even in the presence of stimulated NPHR neurons. And as extinction training continued, we saw increased activation of that ventromedial prefrontal cortex. So this tells us that eventually we might be looking at activating the medial or the ventromedial prefrontal cortex to hasten the process of extinction. We also found that infralimbic activity likely plays a role in reducing food-seeking behavior and self-administration behaviors involving drugs and food, sex, and rewards in that pathway. So future implications of optogenetics could be targeting that area to try to reduce instances of drug abuse and the likes of substance addiction. So then here's my sources. Thank you.